Hello, please subscribe and like for our channel. Thanks very much.
Hello, so in this case, you have a 66-year-old man that consulted due to several retrosternal squeezing chest pain lasting for 24 hours. So you have a 66-year-old man that consulted with several retrosternal squeezing chest pain lasting for 24 hours. The patient was aware of being hypertensive and was a smoker without any prior symptom. He started to have severe chest pain after about 24 hours due to pain persistent. He consulted. His ECG is shown below. What's the main finding of this ECG? Already when you have read the symptomatology of this patient, you think of an ischemic heart disease. Is it clear? You think of an ischemic heart disease. Is it clear? So you have a patient that has risk factors of hypertension that present with a retrosternal squeezing chest pain. Is it clear? Without any prior symptom. He started with severe chest pain after about 24 hours. Is it clear? Presented after about 24 hours. So you think of an ischemic heart disease. Now, when you are going to now look at the ECG, you try to evaluate now for the sign of ischemic heart disease on the ECG, and you have that on your ECG interpretation book that we sell. So if you want to know the major details, all the details of the ECG interpretation, you contact us on the comments, or you contact us on our Telegram, YouTube, or the WhatsApp channels. So in this case, they say give the main finding on the ECG. So the main finding of the ECG that you try to evaluate, you try to first evaluate if there is an SC segment elevation, and yes, there is an SC segment elevation. Is it clear? So you see an SC segment elevation located at the V5, V4, V5, V6. Is it clear? You have also an SC segment elevation located at V2 and V3. Is it clear? So you have SC segment elevation that you have already seen very clearly. Is it clear? So you have even prominent cure wave. Is it clear? You can see even a prominent cure wave located at the V2. Is it clear? The prominent cure wave only tells you that what the infarction has occurred in the past, while SC segment elevation tells that the infection has occurred in the present. It means that the patient has both a past infection and a present infection. This is because the patient has waited for 24 hours. So you have a prominent cure wave and you have SC segment elevation. So my major thing that I'm going to tell you to write in their exam is SC segment elevation. So question number 2, what's the most likely diagnosis? Is myocardial infarction. Are you understanding? So you have an elevated SC segment that you can see very well there. Now, myocardial infarction is a diagnosis. Give 3 major risk factors for this condition that you can see in the equation. The patient is 66-year-old. So you have the age. Is it clear? The age is a cardiovascular risk factors in males. When even the sex, is it clear? The male sex, you have to know that generally cardiovascular risk factors are divided into traditional risk factors and we have novel risk factor. Among the traditional cardiovascular risk factors, it is divided into modifiable and non-modifiable. Now, among the non-modifiable, we have the age of a patient that is more than 60 years. Is it clear? We have sex. Cardiovascular disease are more prominent in male than female. Is it clear? We have the third one. Postmenopausal women are going to have an equitable cardiovascular risk factors like now males. Is it clear? So postmenopausal. So those are the different elements of non-modifiable. Now, among the modifiable cardiovascular risk factors, we use the mnemonics, heart mnemonics. H for hypertension, A for alcohol consumption, D for dyslipidemia and diabetes mellitus, and S for smoking and sedentary lifestyle. So all those are the traditional risk factors which are divided into modifiable and non-modifiable risk factor, cardiovascular risk factors of diseases. Now we have novel cardiovascular risk factor that has been found to cause cardiovascular diseases. Among the novel cardiovascular risk factors, we use the mnemonic high UPEC, high-UPAC. H for left ventricular hypertrophy and HIV. HIV is a novel cardiovascular risk factor with left ventricular hypertrophy. I for chronic inflammatory diseases, like in the case of systemic lupus erythematosus, rheumatoid arthritis, gouty arthritis, all that are associated with cardiovascular risk factor. U for uremia and uricemia is equal. When somebody has uremia, uricemia in the case of kidney failure is associated with that, or uricemia in the case of gouty arthritis is associated with cardiovascular risk factor. P for proteinuria. Somebody that has proteinuria has high cardiovascular risk factor. Why? Because proteinuria results to what? Results to a glomerular sclerosis. That is associated with hypertension. Now, A for anemia. Somebody that has anemia is also having a cardiovascular risk factor because it's associated with a high cardiac strength or high workload from the heart. And then the last one is K for kidney failure. Is it clear? When somebody has kidney failure, it's also associated with high cardiovascular risk factors. Now, the next thing is, I've already said all the risk factors that you can have already for your different questions, so you can answer. So for me to say thanks for your kind attention, please don't forget to like and subscribe for our channel. Thank you.
Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our 2 channels, Science Video Makers and SchrDbb. Let me say the number again, 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.